All right. So once again, I'm David Stack, president of CAPS, and we're here tonight with Dr. Steven Chussid. Dr. Chussid is a graduate of the Buffalo School of Dental Medicine, and he's taught at multiple dental schools, including our own Columbia University. He's been engaged in academic, research, and clinical spheres of pediatric dentistry, and is in charge of the section of growth and development, and we'll be able to learn a lot from him tonight. So without further ado, Dr. Chussid, thank you for being with
Thank,
us.
my pleasure. Thank you for the introduction. And again, it's a small group, so please, if I'm unclear about anything, feel free to interrupt while I'm talking.
So, I like to start off with the question of what made you want to be a dentist? What got you interested and kind of started your path towards this career?
Yeah, it's interesting, and we chatted for a few minutes before before we started here, and I went to college not at all thinking about dentistry. I was a biology major. I went to University of Buffalo, and I was thinking about something in the health professions. I became an emergency medical technician and worked on the ambulance corps at our university, and also worked some night shifts in the emergency room at Stony Brook, and decided medicine was not for me. Now it's become more traditional as taking a little time off between college and dental school. I did do that. And then started speaking to people. I had a very good relationship with my dentist, who I never, before entering, and I'll go into this later, but never knew pediatric dentistry was a specialty. But I had a good relationship with my general dentist, started thinking about that, took the DAT, and went to University of Buffalo Dental School. So it was really just a matter of a health profession I thought I would be happy in, having some role models. There were no dentists in my family. So I made the decision, I guess, kind of late, but one obviously, honestly, I've never looked back at. It's been a great career.
That's awesome. That's really great to hear. How sometimes things start off maybe a little bit uncertain and then kind of all come together.
Yeah, I've met a lot of people over the years, dental students and residents in our pediatric dental program, who some from the time they were 5 years old knew this was for them, and many others that made that decision somewhere along the road. So I don't think there's a right or wrong answer. It's just individual.
And you kind of started to get into it a little bit there. So you said you didn't really know that pediatric dentistry was even really a thing. So what, kind of spurred your interest? What got you to make that kind of jump into pediatric dentistry?
Yeah, I've thought about that, and I think another reason for that are mentors and role models that kind of lead you sometimes to the right career path. I had a wonderful pediatrician when I was a kid, somebody who I just adored. So I think that was maybe in the back of my head. My family are educators, so I think that part of pediatric dentistry attracted me. But our curriculum at Buffalo is very similar to what it is here in Columbia, where third year you start exploring some specialties. You do rotations in different specialties, and I just found my days in pediatric dentistry were days that I really looked forward to. I had some great role models there, young, enthusiastic people who just seemed so happy. It was just a fit for me. The clinic always had a great vibe, and the more I looked into it, it just had some qualities that really attracted me. I think it's different than other specialties in that pediatric dentistry is an age-defined specialty, whereas other specialties are really more procedure-based. So endodontics, you're going to be doing root canals. There's variation in that, but pediatric dentistry is unique in that it is defined by age. It's considered both a primary care specialty and primary care and a specialty, and that you're providing comprehensive care to this certain age group. What also attracted me was the ability to work with patients with special needs. It's a big part of pediatric dentistry. It's a big part of what we do, and something that I really enjoyed and found very rewarding early on.
I know you kind of started to briefly mention, you know, going into the uh, pediatric dental residency, and I know you've been involved in, the faculty end of pediatric residency. So, do you mind just telling us a little bit about that? What that kind of looks
Yeah,
like, how it might differ from other specialties?
absolutely. And again, getting a little more into the specialty, another thing I really liked about pediatric dentistry is the ability to do hospital dentistry. And pediatric residencies are a little different than others in that they can be done within a dental school or within a hospital. And that does make it kind of unique. The specialty is the same. The certificate you get from each is the same, regardless if you do your training in a hospital or a dental school. It's a 24-month program. There's certain basic requirements. The Commission on Dental Accreditation accredits all programs. I happen to be a site visitor for CODA, so get the ability to see different programs. So wherever your program is, hospital-based or school-based, you have the same accreditation standards. But the focus of the programs tends to be a little different. Our program here at Columbia, it's actually a program of New York Presbyterian. So it's a hospital-based program. There's a couple of things involved in that. Hospital-based programs tend to be a little more clinically oriented, where school-based tend to have more of a didactic focus. Another difference will be that hospital-based programs, you get paid. School-based programs, you pay a tuition. So a lot of other specialties, prosthodontics, endodontics, those generally are not offered within a hospital. So it's additional several years of tuition within a dental school. The difference in pediatric dentistry is you have a choice or you have the option of each. Working within a hospital is something that I found really, really exciting. I did my residency at Children's Hospital in Buffalo after dental school. And I'll just digress a little bit, just to give you a little bit about my background and how I got to be where I was. Um, Once I decided to become a pediatric dentist, I again trained at Children's Hospital in Buffalo. I think also it may be a little premature for you guys, but if you really are considering the specialty, I think training in a children's hospital, there are real big advantages to that. Um, you deal with some very sick kids, kids with syndromes, kids with conditions that you may never see in practice, but it prepares you very well for practice. You take call, you cover the pediatric emergency room. So you'll see children with trauma, dental trauma, with other kinds of emergencies, and you get to work with other pediatric specialists. When I did my program, I really enjoyed my residency. I enjoyed working within the hospital, but my career path was for a nice, quiet private practice. Um, my first job was in New Jersey. I was an associate in a practice there and really thought that's where my career was headed. I found private practice, I don't want to say boring, but I kind of missed the excitement of being in a hospital. So I decided to start teaching part-time. I started teaching at NYU while I was practicing, and then became full-time at Montefiore Medical Center. I was there for 10 years and have been here at Columbia, excuse me, for close to 20. July will be 20 years here. So I found education and I found the specialty in working with the move from Montefiore here to Columbia was really predominantly to have the ability to work with dental students. I work with my residents in pediatric dental specialty, but working with dental students and hopefully exciting them about the specialty and exciting them about treating children, whether they ended up specializing or not, is something that I find very, very rewarding. So, as you look at residencies, orthodontics, for instance, maybe 3 years. Oral surgery could be up to 6 years if you get your combined MD. Pediatric dentistry is a 2-year program and again trains you to treat children of all ages, and you do get a lot of experience treating patients with special needs.
So in looking at kind of treatment of children or treatment of patients with special needs,
Mhm.
what are some of the challenges that other specialties might not face or might not, even think of when kind of
Yeah,
looking at that sphere?
it's a really that's a great question, and we run into this issue in dentistry that your dental school curriculum is so packed. You really most dental schools, almost none, you get a great deal of experience of treating patients with special needs. So there's a comfort level there. It's a matter of working with other medical subspecialties, um, understanding that, as much as you're focused on oral health, a lot of these patients and their families face significant issues. Um, Another part of, part of what we do for patients with special needs and other patients um, is treating them in the operating room setting, again, which other than oral surgery is kind of unique to our specialty. So many of these patients with some TLC, with a knowledge of their capabilities, knowing that particular patient, we could treat in a traditional dental setting. There are a number of patients, patients with severe cardiac issues, patients with severe cognitive issues that we cannot safely and adequately treat them in the dental chair. So we do treat them in the operating room setting, which is another nice part of, for certain people, a nice part of the specialty. I think something also to consider about the specialty, it does give you a great deal of flexibility. There are pediatric dentists that may practice in a quiet setting and do not do cases in the operating room. They'll refer those cases out. If that is something that interests you, it is something that is available within the specialty. So it does give you, I think, a good amount of flexibility, maybe compared to other um, specialties where you're going to practice. The setting may be different, but you're going to be really doing the same things.
I think that's really interesting. I feel like that's kind of a side of the specialty that people might not immediately realize, or it might not always be immediately apparent that you have that degree of flexibility and that range of options.
Yeah,
Um,
I look at what my graduates, and again, I've been doing this, I don't even want to do the math, but I've graduated a lot of pediatric dental residents, and the scope of what they do is really remarkable. How they practice, what they choose to incorporate into their practice. Um, the one thing that seems to be universal is they really enjoy what they're doing. I mean, if you are suited to the specialty, it's hard in a lot of ways. It's physically taxing. One of your questions was, how does it vary? How does it differ from treating adult patients? Um, you're treating in pediatric dentistry. You're not just treating the patient. You're treating the family, and you have to deal with the family. I think if you ask 100 pediatric dentists what's the toughest part about their specialty, um, 99 will say the parents and not the kids. It's so you really it's physically challenging, it's mentally challenging. You're dealing with your patient, but you're also explaining things as you go along to the parent. So it is it's different in that way. I think a rewarding part of the specialty is that you really have you can have a huge impact, not just on the child, but on the family. So many parents come in talking about negative dental experiences they've had a child, and the jokes, and every movie. Dentists are always portrayed as these masochistic a group, but taking a child who has no preconceived notions about the dentist and turning them into a patient that enjoys coming is really, really very, very rewarding. And, many of the diseases we treat in dentistry are preventable. It's a wonderful thing, but it could be a very frustrating thing when you see the manifestations of this preventable disease. In pediatric dentistry, you have the ability, it's more prevention oriented than some other specialties, which I think which is great. And if you have that interest in teaching, it's something that you do every day in your practice, and you have more impact rather than telling an adult who's kind of set in their ways, and like I said, the manifestations of the disease may have been already taken effect. With a child, you can really focus on prevention and keep them out of trouble.
And correct me if I'm wrong, but you kind of maybe alluded to this. It seems to me like, a lot of people are afraid of the dentist.
Hmm.
And so it seems to me like, as a pediatric dentist, another layer might even be, keeping people, happy, coming back and, not developing that anxiety about going to the dentist as well.
Absolutely. And we do a lot of education with parents, because even parents that mean well over prepare their children for that first dental visit. So, there are a lot of pediatric dentists that actually send out literature on how to prepare. Children pick up on a lot. A 2 or 3 year old, they do not expect to be scared of the dentist. But if mom or dad keeps saying, "Don't worry, she's not going to hurt you, it's going to be fine," all of a sudden the antenna go up and they tend to worry. So preparing that child and having a parent, even a well-meaning parent, not transmit their fear to the child is great. And look, even children, here we do get a lot of referrals from dentists, from pediatric dentists, from referrals all over, for kids who have had issues in other offices. It could be medical issues, behavioral issues. Turning around a child who comes in super, super frightened, and having that patient may not be in one visit, but eventually turn into a good, solid dental patient, one who does not fear coming in, is super rewarding. And again, you're having an impact on that child for the rest of their life.
That's amazing. Yeah, it's especially coming from a pediatric dentist, it's good to hear that there's such a concerted effort to kind of move in a direction that people aren't going to be nervous, and not setting up or perpetuating a system where people are continually afraid of the dentist. So
Absolutely. We
that's
try to
awesome.
break that cycle, and, if again, we can make the experience as pleasant as possible, for the child. It also translates to the parent. They can kind of see, um, really what's involved, how gentle and caring we could be. They don't avoid bringing the child back because of fears they have about the experience.
Definitely. And kind of maybe going into a little bit of a different direction from the
Yeah.
clinical. Um, I know that you've had a bit of research published, and
Mhm.
that's been in pediatric AIDS patients or speech prosthesis. Can you just tell us a little bit about pediatric dental research, maybe what that looks like, how it might differ from other types of research,
Yeah.
things like that?
A great question. A lot of what we do in pediatric dental research, it could be behavioral. There is the type of research that translates across specialties, dental materials, things like that. A lot of what we do is in growth and development. We did an interesting study years ago about patients who did require treatment in the operating room, and these were healthy patients otherwise, but that had a significant amount of decay. And most people think of decay, you might get a toothache, or um, cosmetically you may have issues, but especially in children, decay and oral health issues, pain in their mouth, can um, can have huge effects on the child and family, their growth, their development, the amount of time they're out of school. Um, so we just study, looking at students, looking at patients we treated in the operating room, looked at their weight at the time we did the intervention, and followed them after. And we found a lot of these kids gained significant amount of weight following the procedure, which you might think the opposite, especially if our treatment involved extractions. But these kids actually ate better. When you're talking about 2, 3, 4 year olds, they don't know anything different. They live with this pain. Eating is an issue for them, even if they don't overtly complain about it. They don't get the nutrition they need. So, I mean, it was an interesting study. There are a lot of studies again about some behavioral management techniques. Studies have been done, do kids do better with parents in the room with them or outside? So I think compared to some other specialties, behavioral issues and family dynamic issues are looked at maybe more than others. Other issues that are talked about, there's a lot of case reports about with sick kids, as you mentioned, with AIDS, but also sedative medication. Sometimes we give, if we may not bring them to the operating room, but we may give them a sedative to relax them enough to get quality treatment done. So different sedation regimens are another, I would say, a hot topic in pediatric dentistry compared to maybe some others.
So one thing you mentioned that I just want to maybe hear a little bit more about is kids speaking up a bit.
Mhm,
I know that sometimes adults have a hard time speaking up if it's about a dental problem, whether it's
mhm,
because they're nervous or just because they don't want to complain.
mhm.
Do you find that kids are more willing to speak up about discomfort and things like that, or less?
It's a great question, and it really depends kind of on the age of the kid. We sometimes get the opposite problem. A parent may bring the child in for an emergency, saying they've been complaining of a toothache, but somehow miraculously, when they're sitting in our chair, you're like, "No, I'm fine. Nothing hurts." So you have to do a little detective work. Um, but you look for other signs in kids. They may not again overtly say it, but you could kind of tell. So
Mm,
sometimes you do have to play kind of detective between what the parent is telling you and what the child is telling you.
definitely. And kind of going off of that, um, are there certain things that you see, pathologies that, show up a lot more than others, or is it really just kind of across the board?
Well, it's interesting. You do pick up a lot of pathology in children um, that may follow them throughout their adult life. Missing teeth, for example, and I don't know how many people are on the call, but um, missing adult teeth are something that's quite common. Some more than others, but probably um, 5% of the population is missing at least one permanent tooth. And that may not sound like a lot, but if you see a few patients or a bunch of patients in the course of a day or a week, you're going to run into that. Pathology like that is picked up in childhood. There are certain diseases where first sign may be um, issues with the mouth. Um, we had a patient several years ago who, after kind of routine dental visit, had oozing from the gums and bleeding for days after. And we do this all the time. That's not normal. We had a hematology consult, and it was a patient with undiagnosed von Willebrand's disease. So, we work with medical specialists a lot, and sometimes even shape of the teeth or things like that. Uh, Shape and or of different oral structures can you work in conjunction with, for instance, a geneticist, and you may be able to help identify a particular syndrome that the child may have. We have a very at Columbia we have a very active craniofacial team. It's another nice part of most pediatric dental residencies are involved in that. Some are more active than others. Ours here at Children's Hospital is extremely active. So we see one Friday a month, we see children with craniofacial anomalies. We work as part of a team with ENT and plastic surgery and social work and pediatric medicine, other dental specialties to round on kids with really complex syndromes, determining a treatment plan to help kids with, for instance, cleft lip and palate, to get a team approach and a plan to get that child into different stages of life. Whereas, with adults, I don't want to say things are stagnant, but there's not a huge amount of change from one visit to the next. Um, Following a child from age 1, which is what we suggest now, to many pediatric dentists, and I don't know if any of you saw a pediatric dentist or still do, will see patients throughout college. So you can imagine that the transition they see in their patients. So it adds a whole nother level to what we're doing, being able to monitor and help, sometimes in some cases control growth and development, getting that child in from birth into a good solid adult dentition.
And speaking of growth and development, I know that you're involved in charge of the section of growth and development. Do you mind just telling us a little bit about what that is and what you do?
Yeah, growth. Our dental school is broken up into sections, and there are divisions. So um, I am chair of growth and development, which compromises pediatric dentistry, which I'm the division director, and orthodontics. Very often in dental schools, you'll see those structured together because there is quite a bit of overlap. So we have a separate division of orthodontics and division of pediatric dentistry, but they're combined into our academic structure, into the section of growth and development. So I lead that.
And with all of the hats that you wear, be it
Mhm.
being in charge of the section of growth and development, or working with teams doing clinical practice, teaching, how do you balance it all? And is there something that really jumps out at you as your favorite part, or something that poses a challenge to you that you like to tackle?
Um, Really, what I find most rewarding, and again, it wasn't when I went to dental school, I had no idea this is the career path I would take, but I really love working with residents, covering the clinic, exciting them, just the gratification I get into um, seeing my residents, and now I have residents who graduated 10, 20, 25 years ago. Hiring my current graduates is an extremely rewarding part of what I do. Um, and there are ways to combine both. We have a lot of people who teach part-time, either within the dental school or within the hospital, um, kind of giving back. And I think really that's kind of what I started doing, and one thing led to another, and here I am. I love working in the operating room. It's a time really to work in a smaller ratio with my residents, so I really enjoy that part of it also. There are certain days, look, you may have to make choices and sacrifices. I do miss the let's say the serenity of but certain aspects of maybe a traditional private practice, but honestly, I have really no regrets of the path my career took.
And speaking of the operating room, I know you
Mhm.
said that earlier on that pediatric dentistry is really not as procedurally based as maybe other
Mhm.
specialties are. So do you mind just touching on what kinds of things you do in the operating room that might differ
Yeah,
from like an oral surgeon or somebody like that?
yeah, absolutely. Yeah, and it probably was a little misleading in what I said. It's really the specialty that's defined by the age, but what we do is very much uh, comprehensive dental care. So, very much related to what a general dentist would do. Um, we do, say, a child we take to the operating room. Oral surgeons, there may be a variety of things they do: cranial surgery, extractions. I would say the typical child we bring to the operating room falls into two categories. One may be a very young child that has extensive amount of work, is uncooperative, and just can't tolerate treatment in the dental chair. So for instance, it's not unusual to see a patient who's 3, 4 years old. At that point, they've got 20 primary teeth. We may have to do something on 16 of them. Okay. So even in the operating room setting, we're doing, I would say, traditional dentistry, but doing it in a different forum. The other type of child we bring to the operating room would be extremely fragile children. So patients who need dental treatment prior to cardiac surgery or bone marrow transplant or some other conditions that we just can't safely, because of their medical condition, treat them in the dental setting. But what we do as far as day-to-day in dentistry is very much, we do restorations, we do extractions, we do a lot of prevention in pediatric dentistry, sealants, we do monitor growth and development in a lot of different ways. You know, some of you may have worn expanders or space maintainers or things like that. Pediatric dentistry does a lot of interceptive orthodontics. So it's not uncommon that a pediatric dentist will handle the orthodontics or the interceptive or initial orthodontics for patients until they get to their full adult dentition, so maybe 12 or so. Some of you may have had that experience if you saw a pediatric dentist who may have done, you know, put in appliances or something like that to kind of get you to a point where you're ready for full orthodontics. So the range of care is extensive, and that's why we're considered, and it could really work in our advantage. We're considered a specialty, but we're also considered primary care. So that's why you will see large residency programs in a lot of hospitals that have general practice residency and pediatric dentistry. There's federal funding that allows funding for residents in primary care, and we are considered a specialty, but also primary care.
And with such a wide range of you know, things that you do, are there any kind of misconceptions about the field of pediatric dentistry, or things that people don't realize that you know, you would want us as pre-dental students to know kind of moving forward?
Yeah, I mean, I think the range of experiences, I mean, you got a little taste of it tonight, is huge. I would encourage you, when you do get into dental school, explore the specialties well. And I think what's important also is not just exploring to what's offered to you in dental school. Um, for instance, at Columbia and most dental schools, any dental school I've been affiliated with, the dental students tend to get the well-behaved, you know, cooperative kids with, you know, I would say minor dental needs. Um, you should go visit a pediatric dental practice. You should, if there's a dental residency within your dental school, go spend some time there. Pediatric dentistry or any other specialty you're thinking about, I think it's really important to fully explore it. You want to really know what you're getting yourself into. And it's something I really beat into our dental students. I mean, it's great if you have an interest, but you really need to explore that. You really want to see fully what's involved. In pediatric dentistry, look, you can love children, but you may not have the temperament to be able to provide emergency treatment. You know, you have a 2-year-old patient that you need to do an emergency extraction or put sutures in. You could love kids, but, you know, being able to kind of do what's needed in that condition, you know, in that situation is difficult for some. So you want to explore it as well as you can, whatever specialty you're deciding. And, you know, my advice would be go into dental school with an open mind. You just never know what's going to interest you. So explore it all. But it's, you know, it's a great specialty. It is, not to scare anyone away, but it is super competitive. For instance, at our residency program at New York Presbyterian, we have 5 positions each year. We'll be interviewing next month. We have 290 applications for 5 positions for those residencies, through, you know, applications throughout the country. So it has become a hot specialty. Years ago, it used to be orthodontics or oral surgery would be kind of the hot specialties. Pediatric dentistry has really gotten very, very popular. And I think another thing to think about, you know, I graduated dental school in 1988, and when I decided to go into pediatric dentistry, so many people told me dental decay is going away. There's fluoride now. You're going to have nothing to do. It hasn't gone away. We're still very, very busy. So um, I think that's another misconception of what we do. But I think again, a unique part of the specialty is not just dealing with the patient. It's dealing with parents, and there's a lot of issues involved with that. We get a patient that comes in with extensive decay. There's guilt involved in that. How you present the case. Educating a parent without putting blame on them. Sometimes it's a delicate situation.
Yeah, I can definitely imagine that you have to kind of tiptoe around that sometimes.
Yeah, there's that management of the patient in your chair, but yet you're also dealing with that parent. So again, it can be a challenge, but it's a very, very rewarding specialty. And again, doing this for a lot of years, knock on wood. I mean, my residents are extremely. I keep in touch with a bunch of them, and they're happy, and they reach out periodically to thank us and tell us how happy they are. So I would encourage anybody to explore it fully, but it's a wonderful specialty.
It's amazing. And you gave us some great advice just now. I was just wondering if you had any other advice, maybe as a pre-dental student looking forward to dental school, if you have anything that any wisdom you want to impart on us.
Yeah, I mean, I think it's wonderful to go in with an idea of what you may like, what you may not like. But that being said, have an open mind. Have an open mind about your career path. And looking back, I really wish I didn't. I'm a believer that things work out kind of the way they're supposed to. Um, and you could go in absolutely knowing, look, I want to practice in this town. I want to be a solo practitioner. You never know what's going to interest you, and experiences you have along the way, I think, either good or bad, direct you to where you eventually want to be. So go into things with an open mind. I think going into dental school, try to experience it all. And again, you never really know what's going to catch your interest and pursue it. And again, I think dental school, or in college now, take advantage of everything the institution or everything that's to be offered. If you go into dental school or anything else in life, I think doing the minimum, you're missing out on so much. Dental school is a wonderful opportunity. You're going to meet great people with different life experiences. I mean, get the most you can out of it. I don't know what stage some of you are at, whether you've applied to dental school yet, whether you're planning to, but I think that's also a decision you really have to, I think, look at pretty carefully. There are some dental schools that I won't say prepare you more, but their graduates may follow certain paths. There are certain dental schools where the vast majority of graduates go into general dentistry. There are other dental schools that really prepare you, and most of their graduates go on to some kind of specialty. So if you have an inkling that you might want to specialize down the line, that's a decision or something you may want to think about in earlier decisions, even looking at dental school. It's something to think about.
And then our final question before jumping into Q&A
Mhm.
is just if you could kind of go back and give yourself a piece of, like foresight, make sure to pay attention to this, or, don't forget about that. What would you tell yourself? What, piece of wisdom would you give yourself moving forward?
I would say probably don't put so much pressure on yourself to follow that kind of traditional path. I mean, there may be bumps along the way. I deal with dental students who sometimes do not match. They want to be a pediatric dentist, one particular, for whatever reason, they may not match the first year. You know, I would say don't let little bumps like that define you or break you down. I think there's great experiences to be learned um, from those bumps, and you know there may be you may go sideways, but you eventually get there. So you know, again, I spend so much time and effort looking for that perfect practice opportunity when I first graduated. And it's so far different than what I do now. And I think if you speak to most dentists, um, their first job is not their last job, right? I mean, they will uh, may go from practice to practice, opportunity to opportunity, but you know, explore it all. And I'd say going to dental school and everything else, have an open mind and try to gain as much as you can. Don't be super focused. I think you tend to miss out on a lot. There are people that come in, I want to be an orthodontist, or I want to be an oral surgeon, and really, I think, miss out on a lot of what the school, what your experience has to offer. You may think you're going to be doing that. First of all, you may not. And even if you are, you're going to have to interact with the other specialists. So go in with an open mind and learn all you can. You never know what's going to spark your interest.
Thank you for that.
Sure.
And you know, like I said, now we can open it up to a Q&A if anybody has anything they'd like to ask. And you know, I've been talking a lot, so you can feel free to jump in if anybody has anything, or Dr. Chussid, if you have anything that I might have missed that you wanted to touch on or something like that.
Yeah, I mean, first, let's see if anybody has any questions. I'd be happy to answer anything.
I have a question.
Sure.
Some people tell me that for the dental residency, some of the residency you have to pay it, but the residency in the hospital you don't have to pay it. Is the residency in the hospital more competitive than the others or not?
Great question, and it is. Because again, say, you know, I won't speak to the others, but well, say, you know, oral surgery, you don't have a choice. Those residencies are within a hospital. Pediatric dentistry is really the unique one. So yes, I mean the residencies within a hospital that do pay definitely tend to be more competitive. You know, that being said, there are certain responsibilities you have that you may not have in a school. So say my residents have to take call within the emergency room. If you're within a dental school, you may not have to do that. So there are certain experiences that you're going to have within a hospital. Your hours may be a little different than a dental school, but yet the degree you get, the certificate you get when you come out is exactly the same. But yes, hospital residencies are definitely more competitive. Look, not that anything, and you're a hospital resident, so you get paid what the other first year residents, regardless of specialty, get paid. And this year was interesting, you know, although nobody could have expected becoming a pediatric dental resident. During the COVID crisis, my residents were redeployed. So they were working, taking chest x-rays on COVID patients within the ICU at New York Presbyterian. So, you know, it's a little different, you know, again, pray that that's never the case again, but being a hospital resident, you will be asked to do things that you might not within a dental school. There may be emergency operating room cases in the middle of the night, you know, things like that, that in a dental school you may not get. But the basic standards, as I mentioned, are the same between the two. So the standards for an accredited pediatric dental program will have some basic requirements as far as, say, treating dental trauma or dental emergencies that in a dental school, you would get those experiences just during the day from patients walking into the clinic. That level of experience in a hospital program would be more extensive. So I don't know if I answered the question. And sometimes there are different requirements for hospital and dental school programs. But yes, in general, because the difference, financial difference is massive, as you can imagine, in a 2-year program, getting paid depending on where you are in the country, $60,000, $70,000, $80,000 doing a school-based program, having to pay that in tuition. So the financial difference is huge.
Okay, thank you so much.
You're welcome.
I have another question. Is that the dental residence is as busy as a physician residency?
I didn't quite get that. I'm sorry. Can you say that again?
Like the dental residency is as busy as a physician residency or not?
Are they as busy? I think it depends on the specialty. See, we're part of at New York Presbyterian, there's a dental service that would be general practice residents, pediatric residents, dental residents, and the oral surgery residents are all part of the dental service. So no, you may not have the work hours that a first year OBGYN, or surgical resident have. So, the amount of hours and what you're actually doing is not the equivalent, but what's considered a PGY1, postgraduate year 1, would be the same across the board. And if you look at the administrative structure within the hospital, the chief of the dental service is on par with chiefs of other specialties. So it is a service within the hospital with the same responsibilities that any other service would have, if that answers your question.
Oh, okay, thank you.
Sure.
I have another question is that what's the difference as a dentist working in the hospital or working at a private practice?
Yeah, that's a great question. And some people will do a combination of both. In a hospital, we tend to get more medically compromised patients. We deal with a lot of emergency patients that, they can be trauma, but they can also be toothaches and things like that. A lot of times if a patient, there's issues with access to care. So if patients have trouble finding the care they need in the community, the hospital tends to be the place where they go, sometimes for primary care, sometimes for specialty care. And, what I'm talking about are really generalizations, and private practice tends to be, yes, you may have, emergencies, but it tends to be documented patients of that practice who come to see you. It's a more stable patient population, whereas in residency and in hospitals, it can tend to be more transient. So the procedures you're doing may be different, and also the patient population tends to be a little different within the two. Within a hospital, even your staff may rotate and may be different, whereas in a private practice, you tend to see the same dental assistants and staff. It tends to be a quieter, more controlled setting, whereas working within a hospital, those of you who've been to NYP or any other hospital, the lunchroom and well, not these days, but going up in an elevator, it's a different environment and different vibe, I think, practicing within a hospital as opposed to most dental practices.
Okay, so it seems that working at the private practice has a better work-life balance. Is that correct?
I think that varies, and there are plenty of people in private practice that work 6 days a week, so that would be, I think, tough to generalize. I mean, I think one thing that's kind of nice about hospital practice you know, hours could be good, or in academics in general. Let's get away from a hospital dentistry, but you know, look, in academics, I would say in general, the financial rewards may not be quite the same as in practice. So like a dentist that teaches full time within a dental school, yeah, the financial rewards may not be there, but quality of life as far as hours, as far as benefits and things like that, there are advantages to it. And I think, you know, anything in life, there are going to be pluses and minuses, and you know, sometimes the grass looks greener on the other side. But you know, I look back at my career. You know, it was very nice for me not to have to work Saturdays, for instance, to go to all my kids' soccer games and baseball games. Whereas, you know, if you're in private practice, practicing on Saturdays is something it's a busy day, especially as a pediatric dentist. It's pretty much expected. So you know, there's cost and benefit to everything. So, you know, but I think, you know, as I said earlier, I think it's important as you look at your career to look at all of that, and not to, you know, generalize and say all private practices are the same. People work for large dental companies now. There are a lot of those, and people practice in those. So you may have less of a responsibility as far as the business end of your practice, whereas a lot of other people, they really like that. You know, owning a dental practice is a business, and you know, if you don't have an interest in the business end of things, working for a larger company or being in academics is something that may interest you.
One quick
You
question
know,
I had
yeah, sure.
is, and I know you just touched on it just before, but with COVID, how have you seen pediatric dentistry change? You know, I know you said for the residents, it's been more of, you know, maybe having to do a chest X-ray or something like that. But
Right.
maybe from, you know, the attending perspective, or the, you know, the
Yeah, I
practicing.
mean, it's a good, just, you know, who knows what things will turn out being, but it's changed dentistry quite a bit. You know, it's slowed us down in that the tremendous amount of PPE we use now, that's changed quite a bit. You know, as you can imagine, so much of what we do and how we interact, especially with children, is facial expression. So you can imagine with 2 masks on and everything like that, it is, you know, it has become challenging, where normally we have it could be 2 parents, the whole family come back into the treatment room with us. Now we really have to limit the number of people that are back. So it's different, you know, but we'll find our new normal. When I went to dental school, it was just as AIDS, we were starting to understand AIDS. This may sound, you know, unbelievable, but when I went to dental school, we didn't wear gloves and masks treating patients. So, you know, yes, I like to say it wasn't that long ago, but I guess it was. But it was, you know, it was when AIDS first came to light that we took universal precautions. But I went 4 years of dental school, never wearing gloves, never wearing a mask. The thought of that now is like, oh my God, you know, how could you ever do that? So I think, you know, look, after COVID, we may learn some things that may stick with us in protecting ourselves and our patients. But the transmission in dentistry is extremely low, I think, because of all the PPE, we were even compared to the general population. So I think that's all good, but it has changed practice. We're looking at things around our environment, air exchange and filters and things like that. And again, the amount of PPE we wear are quite extensive. We try to get volume in our waiting room down, where it used to be, we used to have books out for the kids and toys and all that. And now things are a little more sterile. We minimize their amount of time in their waiting room. They come right into the operatory to try to just protect the entire patient population. But I don't think it's anything that should scare anyone off. As you know, again, back in the mid 80s, the late 80s with AIDS also, a lot of people in dentistry were like, before we knew modes of transmission, is this really for me? It really shook people up, but this is nothing that I don't think should alter your plans. We'll get through this, and whatever the new normal will be, we'll get used to it, and it'll make everyone safer anyway, if anything good comes out of this.
And I think we have time for one or two more questions.
Sure.
Hi, I just want to say thank you. I think you gave us really good insight into your experience and your field in general. I don't want to put you on the spot, but I want to know if you have anything that you dislike specifically about the field, or if there's something you would change, something like that.
I don't want to keep saying the same thing, but parents can be very frustrating. We see a child maybe every 6 months, every few months in certain cases. And when parents, again, knowing that this is a preventable disease, when parents don't kind of take responsibility and follow advice you give them, could be very, very frustrating, and sometimes unrealistic demands that they have. They want the child treated in a particular way. They don't want this. They want this. And Google is our enemy. They read things that they are absolutely convinced is fact, and it's their child, and they should obviously question and have. We try to make decisions with parents, but when they are the true experts or think they are, and really don't want to follow sometimes sound advice and like to dictate treatment, it can be difficult. And like I said, it is it's a very satisfying, but it can be a very exhausting career also, because you're not just treating the child, you're putting on, I don't want to say a show, but you're entertaining, you're interacting with everything at once. It can be, depending on your personality, it can be hectic, but it could be a lot of fun. And I think, you spend some time in a pediatric dental office, and I don't know how many of you grew up seeing pediatric dentists. It's a fun career, it really is. And fun people and nice people tend to go into it. And I remember my program director when I was a resident, and I think he was absolutely right. He says, you have more in common personality-wise and otherwise. You'll associate more with pediatricians than you do with other dentists. So I think, as a pediatrician may have kind of a unique personality and personality type, and I'm overgeneralizing, but I think pediatric dentists do also, and they tend to be nice people. I go to multiple dental meetings, and pediatric dental meetings are fun. They're nice people.
Great.
And I think, again, having that, especially, if you have an interest in teaching, a big part of what we do. And I'm not talking about someone in academics like me, but just in pediatric practice, teaching kids, teaching their families, you get that satisfaction. It's really nice.
I just want to thank you so much for, speaking with us tonight, and for, giving us so much information about pediatric dentistry, giving us a bit of a background on what you do, and, the different stages, whether it's, looking at the kind of feeling things out in dental school stages, or learning in residency, doing research, or, doing procedures either in the chair or in the operating room. I really appreciate you, laying it all out for us, and explaining what you do, and the pros and the cons and everything in between. So thank you.
My pleasure. I appreciate the invitation, and you can look me up at Columbia if any questions come up throughout. Questions about pediatric dentistry or dental school or anything else, please feel free. I really appreciate the invitation by the group, and as I said, in my interaction, I love working with my residents and dental students, and this is just kind of adding to that. So if there's anything I can do along the way, please feel free to reach out.
Thank you.